Welcome to Tu Comunidad. Um, like you have seen with several government meetings, we're hosting this quarter show virtually um, using a special tool, the WebEx, and this allows us to have social distancing with staffs and guests. My name is Adolfo Brusino, and I'm going to be your host for this Tu Comunidad edition. Now, speaking of social distances and being safe from COVID-19, we will have later in the show Dr. Rodriguez, Dr. Rayna Rodriguez from Forsyth Community Health Department to be talking to us about what is COVID-19 and the best ways to try to avoid it here in our community. Now, um, also related to COVID-19 are the theme of evictions, which is what we are going to be discussing right now. Now, evictions uh, the North Carolina authorities and here in Forsyth County, where Winston-Salem is located, have been trying to avoid evictions to try to give residents a breather from these. At any given time, trying to change residences it can be a difficult endeavor, but much more so when there is a pandemic going on. And of course, the consideration is the health of the people that need to move out of certain home and the general public, because at the time, remember, if this was started back in March 2020, we were all supposed to be inside the home. So in March 2020, this first started the eviction moratorium. Initially in April 2017 was when these initial North Carolina Governor Cooper's executive order was going to be phased out. But then it was the courts that decided, the Forsyth County court system decided that they were not going to even have eviction proceedings in the courthouse. The date for this um, was June the 2nd. June the 2nd was the original date when people were supposedly will be able to go to the courthouse, landlords that is, and try to file eviction against their residents. This was still extended until June the 20th, 2020, with a new executive order by Governor Cooper, which is the one that still stands in place. The executive order started on the 30th of May, and it will end June the 20th, 2020. During this time, no person should be evicted, or can't a person cannot be evicted from their home. This is residential eviction, but also works with commercial evictions. So nobody can be evicted, and the rent that is due during these 20 days, the landlord has to give the tenant 6 months or up to 6 months to pay it. Late fees will have to be also waived. It is important to understand that the way I am understanding this is that this will only be true during this 20-day period. If there is rent owed previous to this period, I don't think um, it will be qualify under this executive order, which means that late fees that you have from a previous period and the rent that you owe from previous period, you probably will have to pay it, and not in 6 months, but probably rather soon. But the rent that generates between the 30th of May to the 20th of June, which is a total of 21 days, is not waived. The rent is still owed, but that landlord would have to give up to 6 months to the tenant to pay that rent. This means, of course, that until the 21st of June, or unless this executive order is extended, um, no evictions will take place in North Carolina, given this executive order. Um, it is also important to know that those who live in a subsidized complex by the federal government, Um, this protection extends well into July also. Um, so you will be protected if you live in a subsidized housing. In this complex receive a subsidy from the federal government. They cannot evict you either until I believe is it also the 20th of July. So it is important to know that these protections are in place in case you are faced with the possibility of eviction by your landlord. Um, it is also important to understand that the rent has not been waived. The rent is still due, but um, the landlords have been asked to try to be understanding with this and try to give the tenants every opportunity that they can give them to get back on their feet and pay back that rent. Um, Somehow there are no very strict guidelines as to how this needs to happen, but um, they have been encouraged, landlords, to try to give tenants a little bit of time to pay what they owe. Remember, in the case of the executive order that is due the 20th of June, the rent only includes the rent generated in those 21 days from the 30th of May to the 20th of June. If there was something that you owed previous to the 30th of May, you are supposed to pay that rent as soon as possible, and it will not be under this new executive order from the governor of North Carolina, Roy Cooper. I hope this information was useful. Please be vigilant when it comes to your landlord paying the rent and evictions. Remember also that legal aid can assist you in these type of procedures. We also the city of Winston-Salem has a landlord tenant mediation program, and we will try to assist you with it as well. Very soon also, the court system here in Forsyth, in collaboration with the Human Relations Department and Wake Forest University and Legal Aid, will try to assist in these eviction proceedings that may arise, and we will try to mediate them as well. Um, so this is a collaborative effort, and hopefully we will be able to make a difference. So, in summary, if you have an eviction problem with your landlord, you can call us, and we will try to assist you. If you are a landlord also and have these type of issues with your residents, please give us a call. Because we will try to assist you as well in this circumstance. I hope this information here in Tu Comunidad is useful to you all, and thank you for staying tuned with us.
People with COVID-19 can be contagious before they ever have symptoms. When you go out, you have to assume you'll come across someone with the virus who doesn't know it yet. If they pass it to you, you can pass it to an elderly parent or a loved one who is at risk. And this virus could be deadly. Stay home unless it's essential. If you must go out, protect yourself and your loved ones. Wear a cloth face cover. Avoid groups of more than 10. And keep 6 feet between you and everyone else. Fight the spread. A message from the city of Winston-Salem and Forsyth County.
What is the 2020 census? Every 10 years, the census records everyone living in this country.
It's written in the Constitution and comes in a questionnaire that counts everyone who lives at your address on April 1st.
The data can be used to inform funding for services like fire stations, schools, clinics, and representation that affect your community.
How will the 2020 census be used? Where there are more people, there are more needs for public services. The government uses the census to fund programs and services that help everyone in our city and county, including you.
It is also used by nonprofits and business and helps determine how many seats every state gets in Congress.
How do I take the 2020 census? In March 2020, Every address in the country will receive an invitation to complete a simple questionnaire.
And there are 3 ways to respond. Number 1, do it online.
Number 2, call by phone.
Number 3, send it by mail.
For those who don't respond, a census taker from your community will follow up and assist you.
Shape our future.
Shape our future.
Shape our future.
Answer the
the
census.
Well, thank you very much for being with us in another edition of Tu Comunidad. For this show, we have a very special guest. She's Dr. Rayna Rodriguez. Thank you for your time, Dr. Rodriguez. Dr. Rodriguez, she's a bilingual health educator for Forsyth County, for the health department in Forsyth County. Thank you very much for being with us, Dr. Rodriguez.
Thank you so much for inviting me.
Well, thank you. Now, we're going to be talking, Dr. Rodriguez, an issue that is in everybody's mouth for the most part, which is COVID-19, this virus. Now, tell me, Dr. Rodriguez, in simple words, what is the impact that COVID-19 has had in the Latino community here in Forsyth County?
Yeah, so we have a lot of people that are infected in the Hispanic community, and some people are afraid, and some people are concerned about that. We have a different feelings around the community. Some people, when they are sick, they feel like is the last thing in the world, but no worries. This is like a very transmissible, but it's not really bad if you have the coronavirus. And some people are very stressed out because they feel like what they can do for prevent this, what they can how they can stop. And other people say, I don't believe this. We have a different feelings around the community.
Now, please tell the public, Dr. Rodriguez, as of now, we are in the first days of June when we're shooting this video. What is the rate of infection between Hispanics here in Forsyth County, among Hispanics here in Forsyth County?
Yes, we have a lot of Hispanic community. It's more than 1,500 cases right now. But the good news is that we have recovered around 700 people. So we have a lot of cases, and a lot of numbers are still active, positive, but we have a lot of people that are recovering, and they are recovering pretty good.
That is great to hear. Now, in general, Ms. Dr. Rodriguez, what is the best way to protect yourself from the COVID-19?
Yes, we have to follow the 3 good recommendations that we have for the North Carolina Health Department, from the governor, and everybody is repeating the same thing. But those are the 3 good recommendations that we have to do. First is one, using the mask, and it can be one like this one, and like a fabric mask, or one like this one that is like a surgical or disposable mask. You have to use it only once, this one, only for one day, and then you have to put it away. And if you are wearing one of this one, you can use it today. When you're back home, you can wash only with hot water and soap, and then let's dry, and then you can reuse it the next day. And this recommendation would be for around for the whole rest of the year, and probably for the next year. And the properly wear that you have to use it is covering your mouth, your nose and mouth, like this. And be careful, because the virus will be here after I will be outside or getting some groceries or going to different places. So when I'm back home, I will remove from here, from my ears, not touching the front part, and then going to wash. The second recommendation that we are giving to everybody is wash your hands. You have to wash pretty good with soap and water for 20 seconds each hand, and very good. And the third recommendation—
Now, Dr. Rodriguez, does the soap has to have any special characteristics for it to work against the COVID-19?
No, any
No.
soap.
Okay. Any type of soap.
Yes,
Okay.
the virus is really sensible to any kind of soap. And the
Okay.
third recommendation is to keep the social distance. Stay away from the other people for 6 feet, or at least if you cannot measure that, the other recommendation is to extend your hands. And if you are not touching the person, the hand or the other person, when you both extend the hands. So that is that distance
Sorry.
that you have to keep for this person.
Okay. So you extend your arm. The other person also extends his arm, and both
Yes,
arms should be about this, right?
yes,
This
yes,
gap between
exactly.
hands.
Yes,
And when you do that, you have about 6 feet of
exactly.
distance between each other,
That
correct?
is the recommendation. And when we say families can be together, it's only when we say families, it's only the people that are living in the same house with you. So
Okay.
that is how we call families can be together in a place like a church or any grocery place.
I got it. So it's not the extended family. It's not
No,
grandma and my aunts and my uncles, right? It's just
no, yes,
it.
exactly,
It's if they live in your same household, then that's a
exactly,
family. But if they
yes.
live in their own right in their own home, that is not family for these purposes of the
Exactly,
protection
yes.
against the virus. Okay, thank you, doctor. Another question that I have for you is this: are there efforts in place to provide masks to workers who cannot work from home?
Yes, we did, and we're still doing. We have a lot of fabric and companies that they provide to different places. We have a lot of organizations and agencies that they have some free masks, like this one.
Mhm.
One
Now,
is like this one. And
if I go to the health department, can I get masks?
we have some limited numbers here because we just distributed to different agencies and organization church, so they have a mask. If you cannot get a mask, you can call us to the main number of the health department, and you can let them know, and I can give you the information where you can find a mask. One of the organization that has still having mask is Nova Health, is Hispanic League, Eliza's, some churches like ACM, different churches, they have a mask that they can give you for free.
That is great to know. Thank you, Dr. Rodriguez. I have another question for you. And this, now, we've heard, this is how the question was framed. We've heard that many are taking 3 aspirins and lemon juice 3 times a day. How effective is that to ward off the virus? Is that effective, doctor? Or
No,
please tell us of other methods that you have heard people are doing to try to combat the virus by themselves.
yes, the recommendation is please don't auto-medicate yourself because this is a virus. So it's a new virus. We do not know how the virus can start acting in your body. So please don't start taking just any medication because somebody else told you. The first thing that you have to do is going to call your doctor or call us, and we can let you know where you can go and get the test done. After that, we can give you some directions. The recommendation is drink plenty water every single day. Eat pretty healthy. Don't skip any meal. Eat a lot of vegetables, a lot of fruit, especially the fruit that has vitamin C, like a lime, lemon, kiwi, watermelons, a lot of different kind of vegetable and fruit that you can include in your diet. And if you are sick and you are in your home, please keep drinking a lot of water. Keep drinking a lot of vitamin C or eat. And also, the only thing that we recommended that you can start taking is Tylenol, because the Tylenol is working good with all the symptoms, headache, fever, chills, So you can start taking some Tylenol, but you need to follow the recommendation that your doctor or we are giving to you. Please doing that. And people are drinking a lot of hot tea. They say they are feeling good, and I think so is working good. Some hot tea. It's not any specific kind of hot tea. I like a ginger tea, and also ginger is good for your health and your diet. So you can include ginger tea, and it's an idea. You can drink some lemonade. You can drink some orange juice, a fresh squeezed orange juice is good too. But keep in your mind that you need to drink a lot of water, plenty water, plenty liquids, and eat pretty good fresh vegetables and fresh fruit. And you can get better in the next few days. Normally, the virus stay in your body for around 2 or 3 weeks, and then if you still feeling some weakness, because the people say that, so then you can continue drinking plenty water and eating really good. In the next few days, after 2 or 3 weeks, you will back to the normal life, and I promise you will back really good. It's not anything, but after that, remember, please, you need to wear your mask, please. Before and after you are positive, you have to wear your mask and cover your nose and your mouth, because the virus is coming out and going in by the nose and by the mouth. So be careful with that. And kids, the kids, the children, we recommended, if somebody is sick, please, the kids or children or babies that you have in your home, you need to call the pediatrician first and let them know that somebody is sick and the kid is with you, or let them know that if the kid is started having some kind of rash, sneezing, some kind of like a cold symptoms, so the pediatrician needs to know. And keep doing the same thing, the good habits with your kids, drinking plenty water, eating pretty good, cover nose and mouth. Kids after 2 years old, they need to wear a mask, properly wear, and keep doing the same thing with the whole family in your home.
Okay, well, those are good recommendations. Thank you, doctor. Now, and this is another question that I have for you, doctor. Please explain how someone can protect their family from coronavirus if they have a large family. Is there any recommendation for them? If in the home there are, I don't know, an extended family, let's assume that there's grandpa, grandmother, and 3 or 4 cousins, plus your nuclear family, which is mom, dad, and your brothers, and all in all, there's 10 people in the house. Is there a recommendation for them?
Yes, we have the same good recommendation, and also we have a large families here in the community in Forsyth County, and we are telling the same recommendation. If somebody is sick or somebody started with the symptom, please, everybody needs to start wearing the mask inside of the home. If that is only one person sick in the house, so that person, if you can isolate that person in one bedroom, in the bedroom, we recommended the bedroom, if you can have access to, the person can use the own bathroom, that would be a great idea. So that is a good recommendation. If we have some families that they say, well, we are a large family, but we don't have the access to isolate one person in one bedroom with their own bathroom. So please keep using the face mask inside of the home, and try that person is stay 6 feet away from the other person inside of the home. That is the recommendation that we are giving. And please keep drinking a lot of water, eating pretty good, and try to let us know if we can help you.
Well, thank you, Doctor. Those are very, very useful recommendations, especially if you're already with someone infected in your own home. And finally, Doctor, if there was one thing that you could do to prevent the spread of the virus, what it is that you would recommend to people? I mean, if there was one thing that would, wipe it all out.
please, if you can follow the recommendations, the 3 recommendations, that would be my one thing that I would say. Follow the 3 good recommendations that we have. Don't go anywhere with this, please.
Without the mask. And the mask has to cover both the nose
Yes.
and the mouth,
Yes.
like that. Okay. All right.
Always like that. Yes, because some people are like this because they cannot breathe, but you
Right.
can get the virus. Yes,
Yes,
you can get
sometimes
the
the
virus.
glasses will, your glasses will fog up. I have had that happen to me before. You know, you are and you're breathing and you can't
Yes,
see.
I can give you a tip for that. If you clean your glasses with just 1 drop of dishwash soap, you can get that fog away.
Okay.
So we just doing that. And first, for the people that are wearing glasses, put the mask first and adjust to your nose, and then your glasses.
And then the glass. Okay.
Yes,
Okay.
yes,
Okay.
let's prevent that that you can get fog in your glasses like
Okay.
that.
Okay. Well, those are great recommendations, Dr. Rodriguez. Thank you very much for your time and for your recommendations. Dr. Rodriguez is a bilingual health educator for Forsyth County, the Health Department of Forsyth County. Thank you very much for your time, Dr. Rodriguez. Thank you very much to all of us, to all of you who are joining us in this recording. This is Tu Comunidad, and we'll see you sometime next time soon. Thank you again, Dr. Rodriguez, for your time.
Bye-bye.